Hi, this is Dr. Mark. Today I'll be sharing about a patient I just had a second Zoom call with. The first Zoom call was 20 days ago. This is a patient coming in for eczema and TSW. The before photos was before she started the herbs. The after was today, which is 2 weeks later. I think we did a really good job, and part of the reason why is because this patient already is on a very clean diet. It really is helpful when the patient is eating clean while we're trying to treat the eczema or the TSW. Listen on to find out more. This person only experienced minor eczema as a child. Then came her puberty years, and the areas behind her knees flared in a big way. She went on to visit different dermatologists, and so began her journey using oral steroids and topical steroids. Then, as usual, there is a stressful life event and the skin flares. As with a lot of you, over time, she started using more potent steroid creams and started using the creams more and more often. 7 years ago, she commenced TSW. She went through all the different phases of TSW, which you can see in this video here. On and off, she'll be well and things are manageable. And at other times, the skin is not so easy to manage. 3 months ago, the presentation changed. It no longer was red skin syndrome, which is what I call hot and dry. It became a Discoid situation where it is hot and wet. Now, this is where it gets interesting. She did use antibiotics, but her response was not so good. 3 months ago, she did a swab test. She was prescribed doxycycline. Doxycycline usually does well, but in her case, she flared up even more. 1 month ago, she was diagnosed as MRSA and she was given Bactrim. And again, unfortunately, she got rashes while using Bactrim. Her situation is quite unfortunate because most people do well at least immediately when they use antibiotics that are a match. And it usually works out really well, but in her case, it did not work out well. Maybe some parts of her experience will resonate with you as a listener here. This is because her history is relatively common. What is not common is her response to antibiotics. The second question is, why did she respond so well to herbs? To me, her response is really good because in 2 weeks, we made a significant difference. For the answer to this question, you can watch this video here.